Welcome to our show, Health and Wellness, Myths and Facts. Hormones affect everything from blood sugar to blood pressure, growth, fertility, sex drive, metabolism and even sleep. Now, hormones are essential for life and your health. One such hormone is insulin. It's a key factor in the development of diabetes, and this vital hormone that you cannot survive without regulates blood sugar glucose in the body in a very complicated process. There is no doubt that many of you are aware of diabetes, but few are aware of the role insulin plays in the management as well as the prevention of diabetes. Now, according to the report, globally, about 9 million people with type 1 diabetes rely on insulin for survival, and about 63 million individuals with type 2 diabetes require insulin for treatment. Now, although the discovery of insulin in 1921 revolutionized the treatment of diabetes, inadequate access to insulin and diabetes care remains a problem in many countries a century later. Insulin usage and its role in diabetes management are surrounded by various myths, and we have with us eminent endocrinologists who can help you understand how insulin plays a role in diabetes management. Joining us on the broadcast today, Dr. Charandeep Singh Sidhu, Consultant Endocrinology, Diabetes, Thyroid, PCOD and Hormone Clinic in Patiala. Also joining us, Dr. Sowrabha Bhat, Assistant Professor in Department of Endocrinology at the Yenapoya Medical College Hospital. And in a while, we'll also have Dr. Nivethitha Karthika L, the Consultant and Endocrinologist and Diabetologist at Anya Endocrine and Diabetes Center, Madurai. Let's begin with Dr. Sidhu. Dr. Sidhu, hormones are chemicals that coordinate various functions in our body. Now, insulin is also one of these hormones. How do insulin levels affect metabolism in our bodies?
Thanks you for the question. So basically, insulin is an anabolic hormone which is secreted by the beta cells of the pancreas. So anabolic hormone means the hormone which helps to build up our body. And the main role of insulin is to maintain the glucose levels within a narrow normal range, both during the fed state as well as during the fasting state. So during the fed state, as the nutrients enters into the blood circulation, insulin rises and it promotes the transfer of glucose, amino acids, fatty acids inside the cell. Once inside the cell, this glucose can either be utilized in form of energy, and any excessive glucose is then promoted to be stored as in the form of glycogen. And during the fasting state, what happens when the glucose tends to go down, the insulin levels also decreases in the body, which allows the breakdown of glycogen to provide glucose back to the blood. So overall, the insulin role is to maintain a glucose within the narrow normal range. Apart from that, insulin also promotes the protein synthesis and fat synthesis in the body. So that's how it helps to regulate our metabolism. Thank you.
Right, Dr. Sidhu, when glucose levels go down, it impacts the insulin in our bodies. I also want to touch upon another crucial aspect. Now, hypoglycemia is one of the main consequences of insulin therapy. How can hypoglycemia be prevented when injecting insulin daily?
Okay. So, for example, a person, you can, like a person, blood glucose is, when it is below 70 milligram per deciliter, that's when we call it as hypoglycemia. So, in hypoglycemia, when glucose levels goes down, the body fuels decreases in the blood and body's function starts to deteriorate. So there are certain do's and don'ts that we can tell our patients in order to prevent hypoglycemia. The most crucial one is to keep on monitoring your blood glucose. This can be done through a traditional method of blood glucose meters, or it can also be done through our latest devices which are available, like ambulatory blood glucose monitoring, which can give you blood glucose every 5 minutes. So looking at the trends, you can predict hypoglycemia in patients. Apart from that, try not to skip or delay your snack or meal intake. Quality as well as the quantity of the meals, they matter. Apart from that, another important thing is for the patient to understand is never self-medicate with these medications. Anti-diabetic medications are not like paracetamol. So these medicines should be taken under the guidance of a doctor only. In case you want to even want to change your insulin delivery device from insulin syringes to pen device or vice versa, so in that case also it should be taken under the guidance of a doctor, because change of device by patient themselves is a common cause of both hypoglycemia and hyperglycemia. Another important thing is, if you are already on some exercise program or you want to join some new exercise program, because exercise tend to bring the glucose down, you should first discuss with your healthcare team and try to adjust your meal as well as your insulin dosages before intensifying your exercise program. Alcohol is another important cause of hypoglycemia, especially if a person is taking alcohol without any snack. That person can have a risk of hypoglycemia after even as long as 24 to 48 hours after alcohol intake. So, these are one of the factors which can lead to hypoglycemia while patient is on insulin. And in case you are having any traveling plans, try to take a emergency kit with the glucose tablets along with you, and do carry your diabetes identification either in form of a wallet card, or you can wear a bracelet or a necklace that can help the bystanders to understand that you are having diabetes and you are taking insulin, so they can help you in case of emergency. Thank you.
Right, Dr. Sidhu, lots to unpack there. As Dr. Sidhu advises, monitoring blood glucose is key, not to delay your snack or meal intakes, and patients need to comprehend the fact that self-medicating with anti-diabetes medicines is not advisable. With that, let's go across to Dr. Nivethitha Karthika L, who joins us. Now, Dr. Nivethitha, why do people with type 2 diabetes need to inject themselves with insulin? Does an insulin injection mean that a person has failed to control diabetes?
No, not always, but I think majority of the people have this misconception. So I would like to stress upon the fact that when a diabetes patient is started on insulin, so it should not always be considered as a treatment failure in the management aspect of a patient. So people, they often require insulin when their oral anti-diabetic drugs, the exercise plan, their meal plan, all these three are not able to achieve the target meal glucose level, say fasting less than 130, or a postprandial blood glucose less than 200, or their 3 months average HbA1c of less than 7. So what happens is, diabetes is often a progressive disease. So sometimes people require when there is a declining production of insulin. So some people might require it earlier, some might require it later, or some do not require it all. So all these actually depends upon like how much the insulin the person's body produces and how much of it actually is able to act. So this actually differs among individuals. So that is how some people, they require insulin and some do not require insulin. And insulin might even be added as an add-on therapy to the existing regimen, or sometimes it may be a replacement regimen to the other drugs. And there are certain other conditions where insulin is preferred to oral anti-diabetic drugs. For example, during pregnancy, or when someone has a severe acute illness, or someone has acute infections or severe infections, and when you're planned up for surgery. So during those times, we prefer insulin compared to other anti-diabetic drugs. And when a patient has high blood glucose values with associated symptoms, for example, say you have weight loss, you have increased thirst, hunger, or increased urinary frequency, so those times insulin is preferred because it can rapidly reduce the blood glucose values, and it might make the patient feel better and symptom free. So these are conditions where we prefer insulin compared to other anti-diabetic drugs, and it is not always a failure in the management aspect. So that is very important.
Thank you for busting that myth, Doctor. With that, let's also rope in Dr. Sowrabha Bhat, who joins us. If you could just touch upon what is insulin resistance and which specific conditions or agents can cause insulin resistance.
Yeah, thank you for that question. Insulin normally functions to increase the uptake of blood glucose into the tissues. That's the main action. So insulin resistance is when the insulin cannot act properly to help uptake of blood glucose into the liver, into the muscles, and into the adipose tissue, that is the fat tissue. So insulin resistance can be increased in certain conditions like obesity and a sedentary lifestyle. Certain drugs can also increase insulin resistance and hence increase the blood glucose. That is steroids, which are commonly used therapeutically, and also these days many times they are abused also. So they can increase the insulin resistance in our body. A family history of diabetes also can contribute to increase in insulin resistance. So on the contrary, when a person loses weight or exercises, insulin resistance may be reduced. That is, the person may become more insulin sensitive.
Right. What are the precautions for insulin storage, and how long can insulin be stored in a syringe, Dr. Nivethitha?
Okay. So the US Food and Drug Administration guidelines, that is the FDA guidelines, and the insulin manufacturer guidelines, they recommend storing insulin in a refrigerator within a temperature range of 2 to 8 degrees Celsius. So that roughly translates to 36 to 46 degree Fahrenheit. So for a long-term storage till the expiration date. So when the vials and cartridges are opened, so that time we can roughly store around 2 to 30 degrees Celsius. And that roughly translates around 36 to 86 degree Fahrenheit. So, but all these things, they have to be used within a duration of only 1 month. So they cannot be stored beyond a month of more than 30 degrees Celsius. So why it's very important? Because insulin stored less than 2 degrees Celsius and more than 30 degrees Celsius, so extremes of temperature, they tend to lose their potency, efficacy, and they tend to precipitate, they frost and clog. So, but in India, the main problem is most of our room temperature, they normally exceed more than 30 degrees Celsius. So we usually advise the people to store the insulin, especially the vials, in a refrigerator. And while injecting, like before injection, just take the vial out, keep it at, for 10 minutes at the room temperature, or take the required amount of units, draw into your syringe, keep it for 10 minutes in the room temperature, then roll between your palms to normalize the temperature and then inject. So why this is very important? Because even injecting cold insulin, so it usually leads to pain and irritation at the site of injection. So the storage temperature is very, very important, and I would like to stress that store at 2 to 30 degrees Celsius. But for India, storing at room temperature, keeping it at room temperature is not advisable.
Right, a lot to unpack there. So any unopened bottles of insulin should be kept in a refrigerator, as Dr. Nivethitha has encouraged. One should store unopened insulin in the refrigerator at a temperature between 2 degrees Celsius to 8 degrees Celsius. That is key, and one should not freeze insulin. With that, I'd like to take the next question to Dr. Bhat, please. Where's the best place to inject insulin, and what is the minimum interval between insulin injections?
Right. So insulin is a subcutaneous injection. That is, it is injected under the skin. So wherever there is enough or sufficient body fat, insulin can be injected. It gets absorbed in the blood vessels or in the fat tissue. So the best site to inject insulin is the abdomen. So there is a lot of subcutaneous fat there. So we use abdomen and rotate the insulin sites, and that is where the insulin gets absorbed the fastest. The next best site is probably the arm, that is the posterior part of the upper arm, that is where it is injected. Not exactly where the intramuscular injections are injected, it's slightly behind where there is a lot of subcutaneous fat that can be felt. And the third area is in the thighs. Insulin is usually injected in the outer thighs, along the outer border. It can also be injected in the center of the thigh, along the center. It should not be injected on the inner side of the thigh, because inner side of the thigh, even if the skin is very thin, it is very vascular. So there are chances of injecting insulin into the blood vessels. That should not happen. It should go into the subcutaneous space. The fourth site that is mentioned is the gluteal region, that is the buttock area, which is not normally used because it is difficult for self-administration.
Right.
And regarding the interval that you asked between the insulin doses, it of course depends on the type of insulin that we use. For example, for long-acting insulins, they last 24 hours to 36 hours. We have insulins that last even up to 42 hours. So it depends. We have to give that interval, but the insulin that is conventionally used before meals, that is the regular insulin, we have to maintain a gap of 4 to 6 hours between boluses, between each bolus. So it's always better for patients to consult the doctor exactly how they need to get the insulin administered. Even the doses vary with the type of diabetes and between patients.
Dr. Bhat, thank you so much for all that advice. With that, we're stepping into a very short break. Our experts stay on with us to bust all your myths. Back in a moment. We've got experts with us who help you better understand how insulin plays a role in diabetes management. With that, let's go across to Dr. Charandeep Singh Sidhu. Doc, let's also focus on diabetes mellitus. What is the role of rapid-acting insulin in the treatment of diabetes mellitus?
As the name suggests, rapid-acting insulin. So this insulin starts to act very fast compared to the other insulins. So it's commonly given as a basal bolus regimen, and it is injected generally 10 to 15 minutes before you eat meal. So what happens whenever we consume a meal, depending upon the carbohydrate content of the meal, blood glucose tends to rise. So this extra glucose which is entering into the system needs to be neutralized. That extra glucose surge, if that happens in the absence of insulin, that can cause a high alarming level of blood glucose levels in the post meal phase. So that's where the action of this rapid acting insulin starts. So what are the certain characteristics of this rapid acting insulin? So they have a very rapid onset. They start to act within 10 to 15 minutes of the injection site. And because they travel very fast from the fat tissue to the blood, so they start acting within 10 to 15 minutes, and the peak level of action is generally achieved within 60 to 90 minutes after the injection, and their effect lasts around 3 to 5 hours, as long as you are digesting your food. So it is a more punchier kind of insulins, but yet they have a very defined and short action. Within 3 to 5 hours their action weans off. Thank you.
Right. Doctors, now with our conversation, it's quite clear that physical activity affects the way your body uses glucose, and insulin can therefore affect your blood glucose levels in different ways. Dr. Sowrabha Bhat, is it necessary to adjust the insulin dose before exercise?
Yes, it's a very important question. Definitely, exercise can affect the blood glucose levels. First of all, exercise increases insulin sensitivity in the body. So in fact, it makes the insulin work better. So there can be it can push more glucose into the muscles, and then it can reduce the blood glucose levels, so leading to symptoms of hypoglycemia. We must remember that this is a anticipated complication in both type 1 and type 2 diabetes. So this can be a hindrance for exercise. So we normally recommend in diabetics exercise for cardiovascular health. So it can be a hindrance. So one tip we can give our patients is that they need to take a light snack before exercising, and even after exercise they can take a snack if they have missed on the snack before exercising. And also, exercise tends to increase the insulin sensitivity for even up to 24 hours. So especially after a bout of rigorous physical activity, say some long distance running, that risk of low sugar can last even up to 24 hours. So the key factor I would say is monitoring blood glucose levels is important. That is the most important thing. And then keep something to eat at hand so that any complications can be avoided.
Right, very useful advice there. Dr. Nivethitha Karthika L, now many people seem to think they can eat anything when they inject insulin. What are the benefits of eating healthier and staying physically active while taking insulin?
Yes, thank you for the question. So actually adapting a healthy eating behavior and maintaining an adequate level of physical activity is very much important. That is a major cornerstone in the management of diabetes. So people often use the term diabetic diet. So put it in a simple term, it's just eating the healthiest form of foods in moderate amount. So that moderate amount is very, very important. and also stick to your regular meal timings. So these healthier options, they are naturally rich in nutrients, they're low in calories, low in fats, and they include a variety of vegetables except tubers, fruits that are low in glycemic index, whole grains, legumes, and healthy fats. So what happens is when the fiber content of the food is very high, so they help in slowing the digestion process. So the amount of glucose so that entering into the bloodstream is very slow. So the sugar spike is very less. So that is the importance of adding a fiber-rich diet to your regular every day-to-day meals. So that is one aspect. And also limit your intake of foods that is rich in saturated fat and cholesterol, for example, coconut oil, butter, ghee, egg yolk, and those products, and avoid trans fats completely. Those are present in bakeries and packaged food items and confectionaries. And now coming to the physical activity, so the usual recommendation is to maintain 150 minutes of moderate or vigorous intensity exercise in a week. So spread out at least 3 times per week with no more than 2 days passing without any levels of physical activity, and add resistance training, strength training to the muscles. So that is very important in breaking down the insulin resistance, which ma'am was talking about before. And these kind of exercises and diets, so they not only reduce the blood glucose levels, but what is important is they aid in the weight management. So when the weight reduces and the abdominal fat also reduces, so they indirectly they also contribute to reducing the cardiovascular risk factors like high cholesterol, high blood pressure. So everything comes down together when the proper lifestyle is maintained with the proper meal and the adequate level of physical activity. So that is very, very important.
Thank you so much, doctors, for your time and for all your advice. We hope our experts answered all your queries regarding insulin usage and its role in diabetes management. Thank you all for watching. Goodbye.